Hypertrophy occurs via what? An increase in the size. Hyperplasia occurs via what? An increase in the number of cells. What does hypertrophy involve? Gene activation, protein synthesis, and production of organelles. What does hyperplasia involve? The production of new cells from stem cells. Atrophy occurs via a decrease in the size and number of cells. How does a decrease in cell numbers occur? Via apoptosis. Metaplasia occurs via what? Programming of stem cells, which then produce the new cell type. Is metaplasia reversible? With the removal of the driving stressor.
Vitamin A deficiency can result in what? Metaplasia. Vitamin A is necessary for what? Differentiation of specialized epithelial surfaces such as the conjunctiva covering the eye.
Dysplasia is disordered cellular growth. Dysplasia most often refers to the proliferation of precancerous cells. Is dysplasia reversible? Yes, with the alleviation of inciting stress. In dysplasia, what happens if stress persists? Dysplasia progresses to carcinoma irreversible. When does cellular injury occur? When stress exceeds the cell's ability to adapt. The likelihood of injury depends on what? The type of stress, its severity, and the type of cell affected.
What is hypoxia? Low oxygen delivery to tissue, important cause of cellular injury. What is the final electron acceptor in the electron transport chain of oxidative phosphorylation? Oxygen.
Decreased oxygen results in what? Impairs oxidative phosphorylation, resulting in decreased ATP production. What does a lack of ATP leads to? Cellular injury. What are some causes of hypoxia? Include ischemia, hypoxemia, and decreased O2 carrying capacity of the blood. Ischemia is decreased blood flow through an organ. Carbon monoxide poisoning. CO binds hemoglobin more avidly than oxygen. What is the PAO2 and SAO2 for carbon monoxide poisoning? PAO2 normal, SAO2 decreased. Exposures for carbon monoxide poisoning include smoke from fires and exhaust from cars or gas heaters. Classic finding for carbon monoxide poisoning: the cherry red appearance of skin. PAO2 and SAO2 for methemoglobinemia. PAO2 normal, SAO2 decreased. Methemoglobinemia is seen with oxidant stress, e.g. sulfur and nitrate drugs, or in newborns. Classic finding for methemoglobinemia: cyanosis with chocolate-colored blood. Treatment for methemoglobinemia: intravenous methylene blue, which helps reduce Fe3+ back to Fe2+ state. Disruption of NA-K pump results in what? Sodium and water buildup in the cell. Disruption of Ca2+ pump results in what? Ca2+ buildup in the cytosol of the cell. Cytosol swelling results in loss of microvilli and membrane blebbing. Swelling of the rough endoplasmic reticulum (RER) results in dissociation of ribosomes and decreased protein synthesis. The end result of irreversible injury is cell death. The morphologic hallmark of cell death is loss of the nucleus. Loss of the nucleus occurs via nuclear condensation, pinosis, fragmentation, choriorexis, and dissolution, choriolysis. The two mechanisms of cell death are necrosis and apoptosis. Gangrenous necrosis is characteristic of ischemia of lower limb and GI tract. What is wet gangrene? Superimposed infection of dead tissues occurs, then liquefactive necrosis ensues. Wet gangrene. Apoptotic bodies fall from the cell and are removed by macrophages. Apoptosis is not followed by inflammation. Apoptosis is mediated by caspases that activate proteases and endonucleases. Proteases break down the cytoskeleton. Endonucleases break down DNA. Granzyme secreted from CD8 plus T cell enters pores and activates caspases. Free radicals are what? Chemical species with an unpaired electron in their outer orbit. Elimination of free radicals occurs via what? Antioxidants, enzymes, metal carrier proteins. Elimination of free radicals via antioxidants. Glutathione and vitamins A, C, and E. Elimination of free radicals via enzymes. SOD, glutathione peroxidase, catalase. Superoxide dismutase. In mitochondria, superoxide, O2. Greater than H202. Elimination of free radicals via metal carrier proteins. Transferrin and ceruloplasmin. Free radical injury. Carbon tetrachloride, CCl4, and reperfusion injury. What is FMF due to? A dysfunction of neutrophils, autosomal recessive, and occurs in persons of Mediterranean origin. What does FMF present with? Episodes of fever and acute serosal inflammation. Alzheimer's disease. Amyloid beta, derived from J-amyloid precursor protein, deposits in the brain forming amyloid plaques. Gene for J-AP is present on chromosome 21. Medullary carcinoma of the thyroid. Calcitonin, produced by tumor cells, deposits within the tumor cells in an amyloid background.